The human eye is roughly 22 millimeters in diameter. Along the back of the eye, about 65% of its interior surface is covered by a thin layer we call the retina, which is responsible for receiving and focusing all the light coming into the eye into an image that's transmitted to the brain. In other words, the retina is responsible for receiving and transmitting everything that we see. That's a big job for such a tiny body part. The eye is filled with a gel called the vitreous. The vitreous provides nutrients to the retina and the surrounding structures. When that vitreous becomes compromised, it can cause some significant changes to our eyesight.
Over time, another aging phenomenon is that this gel tends to liquefy and condense, and it collapses over the span of your life. And generally that is not an issue. It doesn't cause any problems. But what can happen sometimes is that as this gel is condensing and separating from the retina, it can pull on the retina at the sides of the retina or even in the main part of the retina and cause a tear just by pulling. And what your eye perceives when that happens is flashes of light and floaters in the eye. And these are two symptoms that ophthalmologists very commonly hear about. They're your eye's way of telling you that there's something wrong with the retina and that there's a problem that needs to be checked out. So if you have flashes and floaters, you should see your ophthalmologist right away.
Some people can have those flashes and floaters for a long time without any problems, but when a retinal tear occurs, it needs to be corrected. If caught early, correction can be done with a relatively simple in-office laser procedure.
You would come in and sit at a slit lamp similar to the way you get your eye exam, your routine eye exam. There's a laser attached to the microscope, and we can visualize the tear through a special contact lens. And the laser is used to cause thermal burns around the retinal tear or the retinal hole, and when it's surrounded, it makes the retina stick down in that area to the underlying structures of the eye.
If a retinal tear occurs and it's not diagnosed early enough for laser correction, it can lead to a far more serious complication, retinal detachment.
If you leave it alone, fluid gets under the retina and causes the retina to become detached, and a retinal detachment is a serious problem. Retinal detachments require more complicated procedures, most often some sort of surgical procedure. They have a lot of morbidity and they can result in permanent vision loss if they're not caught early, or even if they are caught early, if they're a severe retinal detachment, it can result in permanent vision loss.
Once the retina detaches, the only solution is to seal the tear and reattach the retina. There are two ways of achieving this goal, and both are very complicated.
One is a procedure called a scleral buckle, where an encircling band is put around the eye to compress the retina so that the gel and the retina become reopposed. The other way is to remove the gel of the eye and to relieve the traction that originally caused the retinal tear. Both of these surgeries have also advanced a lot in the past few years, and there's less morbidity, but they're still complicated procedures. There's a very good success rate, but it's easier to treat before it gets to the point of detachment.
You're more likely to experience a retinal detachment if you are severely nearsighted, have already had an eye injury or cataract surgery, or have a family history of retinal detachment. To prevent a retinal detachment, get your eyes checked once a year or more often if you have conditions that are linked to eye disease. These regular exams help ophthalmologists track changes more accurately, which allows them to diagnose problems at the earliest sign of trouble. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.